For the individual, I think you shouldn't be concerned in that it probably affects somewhere between 2 and 7% of the population. So that's not everybody by a long shot. However, on a population basis, that's a lot of people. It's been a worldwide and a nationwide infection. And therefore, if you took 5% of all the people who've had COVID, that's a lot of people. But your individual risk, if everyone's risks are the same, which I don't think they are, is low.
What are some of the biggest risks that people have?
Well, that's what we're trying to figure out. It appears that it is affecting people who have had mild disease just as much as people who have had severe disease. So it's not a relationship to how sick you were with the initial infection. That's either reassuring or not reassuring. It seems to be affecting middle-aged individuals, although we don't have a very good epidemiologic study either in Europe or in the United States, and the NIH is focusing on trying to obtain this data. But it appears to most of us that it is affecting middle-aged people more often, maybe with a female predominance. That's not so clear.
What type of impacts are people having?
Well, there's an impact across the board in many organ systems so that they appear like different conditions, but it's probably one underlying cause that's affecting multiple organs. So some people have heart problems that they exhibit palpitations and lightheadedness and dizziness. And when they stand up, they're terribly dizzy and lightheaded, and their heart keeps racing and racing, and it can persist. This was a syndrome called Pott's disease before that was associated sometimes with viruses. The cause was really not known, and we're seeing a lot of that. Secondly, we're seeing a lot of people with persistent shortness of breath, despite relatively improved CAT scans and relatively slowly improving lung function tests. They're still complaining of shortness of breath on activities, walking the stairs in your house, walking outside, carrying groceries, doing activities. The third area that we see a lot is fatigue, and it's tremendous fatigue. Again, similar to an old syndrome that we called chronic fatigue syndrome, which we thought was associated with viral illnesses. It may be the same in this illness, and people just have tremendous malaise and fatigue, and then a few days later start to feel better, and then boom, it comes back. Or even in the day, you feel better maybe in the morning, and then the end of the day, boom, again, tremendous fatigue. So much fatigue that some people can't return to work. They can't function in their daily lives. Others, the fatigue is there and they can manage it, but it has an impact on their life. And I think another big group of symptoms are people who are anxious and depressed, almost have post-traumatic stress from having had COVID and now having these symptoms. And associated with those psychological symptoms are a group of people with neuropsychological symptoms like some memory trouble, thinking trouble, organizing trouble, maybe severe and they feel they can't do their prior occupation, or maybe mild, but it's still difficult to get through their daily activities. And, oh, I forgot to do this. I'm not quite sharp. It's just like being in a fog. That's what the patients describe it as, and the media has picked up on that.
Do we have any ideas or clues about how long these symptoms might last? Are we talking decades?
I wouldn't go out decades. I'm only at the months part right now. We have no idea. However, there's a segment that are getting better over time. And I think we're only at the beginning here. We don't entirely understand the cause, although we think it's vascular damage to the endothelial cells that line your blood vessels from the virus. And maybe that then is stimulating an immune response that's excessive. That's causing all this organ system damage. If we can figure out the cause, then we can figure out how best to treat it. And I think we're going to move into a phase of intensive research and clinical trials of treatments very soon.
Well, that sounds hopeful. Anything else people should know?
Well, I think that they should feel that their symptoms are valid and report them to their doctors. And there are centers like our center at Hackensack University Medical Center where we're consulting for patients and trying to figure out what's going on, and then tracking them, and hopefully we'll have trials to offer them in the future. But the first part is we need to learn about this disease, and we need to hear from patients. In the beginning, a lot of people were poo-pooed. Oh, come on, you can't still be feeling fatigued. You should be better already. Well, I think the first lesson is you have to believe the patients and listen to them, because they're usually telling you the story.
It also goes to show that just because you're told you recovered from coronavirus does not mean it's gone.
The virus is probably gone. This is not the virus anymore. So you had an initial viral infection, and that is alleviated. However, your body has been damaged by the virus or is developed some immune response as a result of the virus. And these post-COVID symptoms are that. They're not the virus anymore, but it's the result of the infection. This is not the only infection that we see sequelae. We see effects of the infection late on. Lyme disease is another example. That's a bacterial infection. However, there are many people who suffer late syndromes from Lyme disease, including heart problems and arthritis and neurologic issues. So I would analogize it to that. It's not the same mechanism at all, probably, but there's an analogy there. So this isn't the first time that people have symptoms later from an infection.